Have you recently been diagnosed with invasive ductal carcinoma? If so, watch this video to find out what to do next. Exercise prescriptions offer so much value to patients diagnosed with invasive ductile carcinoma, also referred to as IDC. But first, let's have an overview over what IDC is. Firstly, understand that it is the most common form of breast cancer, accounting for approximately 80% of all breast cancer diagnoses. The cancer begins in the milk ducts, the passageways that carry milk from the lobules to the nipple, and spreads beyond the duct walls into the surrounding breast tissue. IDC is specifically described by Johns Hopkins Medicine as when abnormal cells growing in the lining of the milk ducts change and invade breast tissue beyond the walls of the duct. Once it invades nearby tissue, IDC has the potential to spread through the lymphatic system or bloodstream, potentially resulting in metastatic breast cancer. While yes, it is typically associated with women, men can also develop IDC. Studies have shown that the risk of IDC increases with age. Current studies show that about two-thirds of women diagnosed over the age of 55, according to the American Cancer Society. Important to note, certain biological traits of the tumor, such as hormone receptor status, can guide treatment decisions. Identifying characteristics of the tumor, such as whether or not cells are sensitive to certain hormones, can help your doctor choose the best treatment for you. There are certain signs and symptoms that you can look out for that would indicate potential development of IDC. If you find yourself with a lump or mass in the breast or underarm, please consult your doctor. If you notice change in breast size or shape, if you notice skin dimpling or puckering, if you notice nipple retraction or inversion, or notice nipple discharge, if you notice redness or rash on the breast skin, or thickening of breast skin, and if you consistently find yourself with localized persistent breast pain, or scaly or flaky skin on the nipple, please consult your doctor. These are all signs of invasive ductile carcinoma. Sure, after your recent diagnosis of invasive ductal carcinoma, you can be very stressed, and maybe you're unsure of everything that is happening in your body. Here is a list of disease characteristics for IDC. IDC originates in the milk ducts and invades surrounding breast tissue. Being the most common form of breast cancer, it accounts for approximately 70 to 80% of all breast cancer diagnoses. IDC can spread to lymph nodes and other parts of the body. These parts of the body include bones, liver, lungs, or the brain. There are many hormonal implications that can occur with this breast cancer. And IDC may present with microcalcifications on mammograms before a lump is felt.
All right. Cancer treatment can be very intimidating. Surgery, chemotherapy, and radiation are all very invasive. However, simply exercise can serve to be so valuable in treatment, offering substantial health support. Did you know that exercise can ease treatment side effects and may reduce your risk of breast cancer reoccurrence? Women who took 5,000 to 6,000 steps per day reduced their risk of dying by 40%. Exercise can also ease fatigue and depression, lessen anxiety, reduce risk of lymphedema, improve physical function and sleep, strengthen bones, and ease bone joint pain. Exercise can also prevent neuropathy. A number of studies have shown that women who exercise regularly have lower risk of reoccurrence and also less likely to die from breast cancer. Doctors fully don't understand this benefit either, but many think that as with breast cancer risk, it may have some meaning to do with maintaining healthy weight and keeping hormones like insulin and estrogen regulated. The researchers have found that women who met their minimum federal exercise guidelines of 2.5 hours of moderate intensity exercise per week before and after being diagnosed with breast cancer had a 55% lower risk of reoccurrence compared to women who didn't meet the minimum guidelines, a 68% lower risk of dying compared to women who didn't meet the minimum guidelines. Even women who started exercising only after breast cancer treatment was completed got benefits from the physical activity. They had a 46% risk of reoccurrence and a 43% lower risk of dying compared to women who didn't meet the minimum guidelines. I know with all these benefits, it's very much persuading you to exercise, but there are some special contraindications that you must take a look at first. Before beginning or continuing an exercise routine during treatment, consult with your doctor first, particularly after surgery or if you're undergoing chemotherapy or radiation. Also, stop exercising immediately if you feel chest pain or tightness, dizziness, or shortness of breath. Avoid exercise if you are experiencing low red blood cells, low platelets or white blood cell counts, poor muscle coordination, and for people with lymphedema risk, see physical therapist first. You may want to visit a physical therapist with an experience in diagnosing lymphedema before you start exercising. You've seen the benefits of what regular exercise can do for your body. Now, here are the general guidelines you should follow. You should start slowly and build up over time. Aim for at least 150 minutes of moderate or 75 minutes of vigorous aerobic activity per week, including resistance training at least 2 times per week, adding in stretching and flexibility training at least 2 times per week as well. Exercise in 10-minute sessions or longer or several times a week. Here is a sample workout I have included. For workout 1, you want a cardio focus. You need a warm up, 5-minute slow walk, plus some shoulder rolls into your main workout, which is 20 minutes of moderate intensity jogging. And then at the end of your workout, start off with a cool down, a 5-minute walk, and some leg stretches. For workout 2, we'll do a strength focus. We'll do a warm up of 3 minutes of light arm swings and side steps. Then go into your main workout of 2 sets of 8 to 15 reps of push ups, resistant band rows, body weight squats, and seated dumbbell curls, including some dumbbell tricep extensions for your triceps. And then we'll follow that with a cool down of some deep breathing and stretching. Then for workout 3, it can be a flexibility balance focus. Warm up with gentle head rolls, standing marches, and then go into your main workout, 15 minutes of yoga, 5 minutes of balance exercises like single leg stands and reverse lunges. Then end that off with the cool down of some deep breathing or meditation.
Oh, I know many of y'all are asking, how can I get involved? Well, I got multiple ways for you. There are multiple regional or local groups for this cancer. There's the American Cancer Society, the Cancer Support Community, and the Self-Regional Healthcare. So, with all this being said, how can we improve physical activity in our patients with invasive ductal carcinoma? There are multiple measures that we can take to make sure our patients continue to be physically active and have fun while doing this. One way to do this would be by setting goals for our patients. An example of this would be having them walk an hour each day. And the next thing that we want is for them to have fun and enjoy what they are doing. Obviously, everything won't always be enjoyable, but after we get through those difficult activities, we have to give them something enjoyable to do. For example, if they like to swim, we're going to let them swim. And if they enjoy biking, we're going to let them bike. And finally, community is everything. So finding our patient a small group to be around that they can enjoy their activities with and celebrate their victories, that's what we need. So, overall, the most important things to keep this person in a physical activity is making sure they have goals, celebrating, supporting them through these goals, and most of all, make sure they enjoy what they're doing. Because the more they are enjoying doing their exercises, the more they'll want to do them, and the healthier they'll get.